Hi guys, in this video we are going to discuss about the skull bones, the important fontanelles. For proper understanding of the osteology of skull, we divide skull in two regions, the facial region or the facial skeleton and the cranial skeleton. In the cranial skeleton, the anterior most bone is called the frontal bone. The frontal bone is the largest bone. It covers most of the anterior aspect and superior aspect of the brain. It is connected inferiorly with the nasal bone and connected posteriorly with the parietal bone. The suture here which separate the frontal bone from the parietal bone is called the coronal suture. It looks like the crown, therefore it is called the coronal suture. Just posterior to it is the paired parietal bones. The parietal bones are two in number, the right parietal bone and the left parietal bone. After this, we discuss about the occipital bone. Occipital bone is the posterior most bone. It covers the posterior aspect of the brain and it is present just about the neck. It is connected anteriorly with the parietal bone and antero-inferiorly with the temporal bone. Temporal bones are also paired bones. It is present on the left side and as well as on the right side. Temporal bone is articulated posteriorly with the occipital bone. This bone is the occipital bone, and superiorly with the parietal bone. The bone which I have mentioned with the cursor is the parietal bone, and anteriorly is the zygomatic bone. Here is the zygomatic bone. Similarly, if we discuss about the facial bones, and facial bones, the 6 bones are paired bones while the 2 bones are unpaired bones. First of all, the largest bones. The largest bone of the face is the mandible. Mandible is the largest and strongest bone of the face. It is unpaired bone. This bone is the mandible. It is connected superiorly through the temporomandibular joint with the temporal bone. The mandible helps in the mastication of food. After this, the bone just above the mandible and the alveolar fossa is the maxillary bone. Maxillary bone is the paired bone which is present on the right side as well as on the left side. Maxillary bone is articulated superiorly with the frontal bone and laterally with the zygomatic bone. This bone is the zygomatic bone. This bone is the maxilla. Similarly, if we go deeper into the skull, the bone is called the vomer. Vomer is the unpaired bone. It is single bone present inside in the skull. These bones I mentioned is the nasal bone. Nasal bones are also paired bones. Nasal bones are connected superiorly through the frontonasal suture. The suture is the membranous immovable membranous joint. It is present in between the skull bones. Similarly, if we discuss about the important sutures, the suture here which connect the two parietal bone, it is sagittal in position. It is called the sagittal suture. And similarly, the lambdoid suture, which is just like the shape of lambda, which connect anteriorly the parietal bone and posteriorly the occipital bone. The point where the sagittal suture and the coronal suture intersect, the point where the sagittal suture intersect the coronal suture is called the bregma, and posteriorly the point where the lambdoid suture and the sagittal suture meet is called the lambda. Similarly, the point where the coronal suture, the suture in between the sphenoid bone, in between the temporal bone and the parietal bone is called the pterion. Pterion is the weakest point of the skull. If we experience such a blow on the right temple or the left temple, the vessels that are present underneath the pterion is called the middle meningeal artery. Some of the time they are ruptured and the bleeding is caused. And hemorrhage of the brain will ensue. The structure I am underlining is called the pterion, and this is the weakest point of the skull where the fracture to the skull can cause bleeding of the middle meningeal artery. Similarly, if we underline this structure, this is called the asterion. It is present posteriorly. Here, the occipital bone from the posterior aspect and the temporal bone from the inferior aspect and the parietal bone from the superior aspect meet. Point is called the asterion. Similarly, if we discuss about the fontanelle, fontanelles are the structure where the membranous bones of the skull meets, and this is the cartilaginous structure. Fontanelles are the anterior fontanelle which is present here in the sagittal suture and the coronal suture, and the posterior fontanelle which is present just behind there where the occipital bone and the parietal bone meets. The importance of the fontanelle is to allow the the broadness of the brain. When the brain grow in size, the fontanelle allow the growth of the brain. Similarly, they also help in the childbirth. They provide certain type of elasticity to the head of the baby so that the baby can easily pass out from the birth canal. Thank you for watching. Give feedback in comment section. See you in the next video.